Come in.
Hi, I'm Valerie, washing my hands. Is it okay if I come in and do some measurements on you?
Yes.
I'm going to be your nurse until 3 o'clock this afternoon. I'm going to shut the curtain. Do you mind just telling me your name and your birthday?
Sure. Michael Smith,
And your birthday?
2795.
Awesome. Thank you, Michael. All right, so Michael is sitting upright. He's in no signs of distress. His grooming looks good. Everything looks good. No discoloration of his hands and skin. All right. So what I'm going to do first is I'm going to listen to your lungs today, touch a couple spots on your body, tap on you, and kind of look at you, focusing on your respiratory, okay?
Okay.
All right, so I'm going to check your pulse first. Check the radial pulse, it's steady. And then just put this here. So for 30 seconds, it's steady. And are you in any pain today?
No.
On a scale of 0 to 10?
0.
A 0? Okay. So Michael is at a 0 out of 10 pain. His respiratory is expected to be 12 to 20, and his heart rate is between 60 and 100 beats per minute. Awesome. So before we get started with anything, are you experiencing any chest pain?
No.
Have you been dizzy?
No.
Any chest palpitations?
No.
Okay. Have you had any shortness of breath?
No.
And have you been coughing?
No.
No? Perfect. Okay. So I'm just gonna look your skin. I'm just gonna look at your arms really quick. Is symmetric, and then this side, your skin is symmetric. Perfect. And you seem to be having effortless breathing. You're not labored, and you have a regular breathing pattern. And I'm just gonna have you look up, please. Okay. Your trachea is midline. Michael has symmetric rise and fall with his shoulders. No, can I just look at your chest?
Sure.
Okay. No retractions with breathing. Perfect. All right. And then I'm just gonna touch your skin. Does anything hurt?
No.
No? Okay. And it doesn't look like you have any musculoskeletal deformities. Is there any tender spots here that I touch?
No.
No? Okay, perfect. Okay, so what I'm going to do next is I'm going to use my stethoscope and listen to a couple spots. I am going to have you look back up again. I'm going to listen to your trachea first. Thank you. Okay, no strider. And then I'm gonna listen to a couple more sounds in your chest.
Okay.
And this is the first intercostal space. And the second intercostal space. Just let your head up low. Okay, and then I'm gonna listen to. I need to get to your chest area. Kind of goes up a little. Alright, so this is the first two. Okay. Brachial and vesicular breaths, and then vesicular breaths. Different spots. We have clear brachial vesicular and vesicular lung sounds on my patient Michael. All right, and then I'm gonna have you like lean forward a little. Shoot. I'm just gonna put my hands across your chest like this. Okay. Good ratio. And then I'm gonna do this. Can't reach. Alright, so we have a 1-to-1 ratio for AP and T. Your skin is still symmetric, no lesions. I'm gonna just look at your back and your neck. Okay, awesome. Your skin coloring is intact, is symmetric, and your skin is intact. And I'm just gonna touch your back here. Any tenderness? Okay. And it doesn't look like he has any musculoskeletal deformities. And I'm just gonna watch rise and fall of your shoulders. Your scapula have even rise and fall. Inhale and exhale. Okay. Okay. And I'm gonna listen. Okay, so what I'm gonna do is I'm gonna touch a couple spots like this, and every time you feel me touch your skin, can you say the word 99?
Okay.
Yep, right here. Say it. Okay, perfect. Okay. And then I'm also gonna touch in between your intercostal spaces. I'm gonna knock on them.
Okay.
First intercostal space. Second intercostal space. And then 2, 3, 4. Okay, perfect. So the 10 lung fields are symmetric, and there is resonance in all lung fields. Okay, and then I'm gonna use my stethoscope, and I'm also gonna just listen to those same spots with my stethoscope.
Okay.
I may have to, oh, sorry. Lift your shirt a little from the back.
Sure.
Let me start here first. So in the first intercostal space, right, and then second intercostal space, and then Damon, lifting your shirt up a little from the back. Okay. And third on the left, third on the right, fourth, fifth. I'm gonna listen to the side here. Do you mind just putting your arm up a little? And then the same on this side. Okay, thank you. Alright, so the bronchiovascular sounds were heard at first and second intercostal spaces in the first 4 spots. And the vesicular breath sounds in the lower 6 spots were heard. Clear BV and V lung sounds. Alright, Michael, so that's the end. I heard everything I need to hear.
Okay.
Do you have any questions before I go to the doctor?
No, I appreciate it, though.
Alright, thank you.
Thank you.
Open the door.